Brain tumor is a neurological disease. Look at this picture, shows that tumor in frontal lobe. MRI findings. Look at this, and CT. Detail going on. Introduction. A brain tumor is an abnormal growth of cells within the brain or its surrounding tissues. These tumors can be benign or malignant, both of which can exert pressure on the brain, affecting its function. Brain tumors vary in their growth rate, severity, and prognosis, making early detection crucial. Definition: a brain tumor refers to the development of abnormal cells in or around the brain tissue. These can originate in the brain primary brain tumors or spread from other parts of the body. Secondary brain tumors. The tumor can affect the brain's normal function by creating pressure on the surrounding areas, leading to neurological symptoms. Types: A. Primary brain tumors. 1. Gliomas originating from glial cells. Types include astrocytomas, oligodendrogliomas, and glioblastomas. 2. Meningiomas. Tumors of the meninges usually benign but can be malignant. 3. Pituitary adenomas found in the pituitary gland, usually benign but can affect hormone levels. 4. Medulloblastomas common in children. These are fast growing malignant tumors. 5. Scavenomas, tumors of the scaven cells, typically benign. B. Secondary metastatic brain tumors. These originate from cancer elsewhere in the body, like lungs, breast, or skin cancer, and spread to the brain. Causes: the exact cause of most brain tumors is unknown. However, several factors may play a role, such as 1. Genetic mutations. 2. Environmental exposures, example radiation. 3. Family history of brain tumors. Risk factors. 1. Age. Brain tumors are more common in older adults, though they can occur at any age. 2. Gender. Men are more likely to develop brain tumors, although specific types like meningiomas are more common in women. 3. Radiation exposure. Exposure to ionizing radiation increases the risk of brain tumors. 4. Family history. Rare genetic conditions such as neurofibromatosis, Leaf-Framini syndrome, and von Hippel-Lindau disease can increase the risk. 5. Environmental and occupational exposure. Long-term exposure to certain chemicals or toxins may heighten the risk. Complications. 1. Seizures. Tumors can disturb electrical activity in the brain, leading to seizures. 2. Cognitive impairment. Memory, concentration, and decision making may be affected. 3. Motor or sensory loss. Tumors can affect movement, coordination, and sensation. 4. Vision or hearing loss. Tumors near the optic or auditory nerves can cause vision or hearing problems. 5. Hydrocephalus. The tumors can block the flow of cerebrospinal fluid, leading to fluid buildup and increased pressure in the skull. Pathophysiology. Brain tumors disrupt normal brain function either by direct invasion or brain tissue or by compression surrounding structures. The effects depends on the tumor's size, growth rate, and location. As the tumor grows, it increases intracranial pressure, leading to symptoms like headache, nausea, and vomiting. Malignant tumors often grow rapidly and infiltrate surrounding tissue, while benign tumors may grow slowly and exert pressure without invading tissue. The pathophysiology of brain tumors involves the complex interaction between tumor cells and the brain tissue. Below is a step-by-step breakdown of process. 1. Genetic mutation. Initiation, transformation. 2. Uncontrolled cell proliferation, known as a tumor. Malignant tumors. 3. Tumor growth. 4. Compression of surrounding brain tissue. 5. inversion of brain structures. 6. Disruption of cerebrospinal fluid flow. 7. Increased intracranial pressure. 8. Neurological defects based on the location of the tumor. Frontal lobe tumors may cause personality changes, difficulty in concentration, or paralysis. Temporal lobe tumors may lead to memory problems, language difficulties, or seizures. Parietal lobe tumors can affect spatial awareness and movement. Occipital lobe tumors may cause visible disturbances. Brainstem tumors can interfere with basic body functions like breathing, heart rate, and swallowing. 9. Seizures. 10. Metatasis or secondary tumors. In the case of metastatic brain tumors, the cancerous cells originate. This stepwise process outlines how brain tumors grow and impact brain function, contributing to the development of variety of symptoms and complications. Signs and symptoms. 1. Persistent headache, often worse in the morning. 2. Nausea and vomiting. 3. Seizures. 4. Cognitive or personality changes. 5. Vision or hearing problems. 6. Weakness or numbness on the side of the body. 7. Balance or coordination problems. Diagnosis. 1. Imaging. A. MRI, magnetic resonance imaging, the most detailed scan to identify brain tumors. B. CT scan, computer tomography, often used in emergencies to detect tumors. 2. Biopsy. A sample of the tumor tissue is removed and analyzed to determine its type. 3. Electroencephalogram EEG measures electrical activity in the brain, useful in diagnosing seizures caused by tumor. 3. Neurological exams assess reflex, motor strength, coordination, and cognitive abilities. Nursing diagnosis. 1. Impaired physical mobility related to neurological dysfunction. 2. Acute pain related to increased intracranial pressure. 3. Anxiety related to diagnosis and treatment uncertainties. 4. Self-care deficit related to cognitive and motor impairment. Management and treatment. 1. Surgical intervention for accessible tumors. Surgery is often the first line of treatment to remove as much of the tumor as possible. 2. Radiation therapy. High energy beams target the tumor to kill cancer cells or shrink it. 3. Chemotherapy drugs that kill tumor cells or stop their growth. It can be used alone or in conjunction with surgery and radiation. For targeted therapy, drugs that specifically target certain pathways or mutations in the tumor cells. 5. Steroids used to reduce swelling and inflammation around the tumor. 6. Anti-seizure medications administered to control or prevent seizures. Psychosocial medicine dealing with brain tumor diagnosis can be emotionally and psychologically challenging for both the patient and their family. Psychosocial support, including counseling, therapy, and support groups, can help patients manage anxiety, depression, and cognitive changes. Integrating mental health care with medical treatment is essential for holistic approach. Prevention. While there are no known way to prevent most brain tumors, certain measures can lower risk. 1. Limiting exposure to ionizing radiation. 2. Avoiding exposure to toxic chemicals and carcinogens. 3. Regular monitoring for individuals with genetic predisposition. In conclusion, brain tumors, whether benign or malignant, pose significant challenges due to their effects on neurological function. Early detection and timely intervention can improve outcomes. Treatment approaches have evolved, incorporating advanced surgery, radiation, and chemotherapy techniques, alongside psychosocial support for patients. Ongoing research aims to discover better prevention, treatment, and management strategies. Thank you. Have a nice day.